Hello everybody, I am Dr. Puneet CS, consultant neurologist at Sri Gokulam Hospital. So today we will be talking on a normal a topic which is COVID, which is the current problem all world over, like COVID pandemic. So today I will be dealing with or talking with respect to what is the affection of COVID with related to brain and overall nervous system as such. So as we all know that from almost we are in almost 3 waves, the third wave is going on. From first wave to third wave, various manifestations have occurred in terms of lung involvement and cardiac involvement and brain involvement and nervous system involvement. Today I will be sticking on to the nervous involvement or the brain involvement. They say that over a period of time, whether in the hospital setting or in the house or OPD setting, around 80% of individuals with COVID are affected with a neurological symptom somewhere or other. The most common one being myalgia, headache, stroke and sometimes seizures. So as we all know, how does this COVID affect the brain or nervous system? There are various hypotheses, the most common one being hypoxia. As you all know that the most common organ involved with the COVID affection is the lung. So patient will have hypoxia. So hypoxic damage can occur in the brain and the nervous tissue. The other pathogenic mechanism is the affection of renin-angiotensin system. So as you all know that the COVID virus enters the body through a receptor known as ACE2 receptor. So this ACE2 receptor is involved in production of substances which causes dilatation of the blood vessels. So when there is damage of this ACE2 receptor, there is increased blockage of the blood vessels. Then the other hypothesis is immunogenicity. So there is increased production of pro-inflammatory cytokines. So most of the public and the doctor community at large, they know that the inflammatory markers, everybody knows about these markers like D-dimer, interleukin 6. So many times all this, it's a protocol that any patient with COVID comes, we all do all these inflammatory markers so that we'll know what is the disease state and further prognosticate the treatment as such. Then the other pathogenic mechanism is the direct affection of the virus into the nervous tissue itself. So direct affection or damage. So coming to the manifestations of COVID with respect to the brain and nervous system, the most common one being smell and as well as taste disorders. As you all know, especially in the first and second wave, especially with this Delta variant and all, the most common symptom which was associated with a COVID virus infection was loss of taste and smell. So it was not like doesn't require a doctor to identify that though this patient is having a viral infection probably related to COVID. So many times people only detected, like if they lost taste or smell, they detect that it's COVID. Then why this loss of smell and taste occurs? So this is because of the affection of the nerve known as an olfactory nerve. This nerve is associated with this one taste and smell sensation. Then comes direct encephalopathy. Many patients with COVID are associated with encephalopathy in terms of delirium and unconsciousness and varying degree of consciousness. Then comes stroke. Stroke can be in the form of ischemic stroke, that is routine blockage of the blood vessels, what we call classically cause as pakavada, wherein there is blockage of the blood vessels. Then there is due to a different aspect of COVID, that is increased coagulopathy, like patient will have increased bleeding tendency, they can have bleeding in the brain in the form of intracerebral hemorrhage, subarachnoid hemorrhage. Then there is another type of stroke known as blockage of the blood vessels, that is veins. So as you all know that veins drain blood from the brain to the heart. So if there is blockage in this aspect, also patient can have hemorrhage and various complications with regard to the affection of the brain. Then we also have disorders in terms of neuromuscular disorders like affection of the nerves. Patient will present with weakness of both upper and lower limb. The classical one being the Guillain-Barré syndrome. So wherein the patient will have affection of the both upper and lower limb, involving both proximal and distal muscles. Patient, if he is not treated properly, can land in respiratory failure and patient can die. Then there is another disorder known as myasthenia gravis. So there also muscle involvement will be there and patient can also have weakness of both upper and lower limb. Then certain individuals also have propensity to develop seizures and epilepsy. As you all know, that patient, if he is not treated properly at the initial stage of epilepsy or seizures, they can land up with status epilepticus, and sometimes if you are not treated properly, they can succumb. So any patient who comes to the hospital with regard to any neurological symptom, whether it can be in the form of loss of taste, smell, delirium, or any unconsciousness, or any patient with stroke, all the patients with stroke, we screen them with COVID test. So along with the COVID test, we also test like inflammatory markers like D-dimer, interleukin 6 and all, so that we know what is the state of the COVID and what is the propensity to develop further complication, whether it can be in the form of thrombosis or it can be in the form of hemorrhage. We also, retrospectively, we also evaluate, like suppose the patient has come with stroke or any neurological symptom to the hospital, we also retrospectively see whether any initial lung involvement was there. So CT chest is rampant, usage is rampant nowadays, so that we will know exact state of the lung state, so that patient will not have an additional complication of hypoxia along with a neurological symptom. Patient, once we diagnose all these symptoms, then we treat with particularly with whatever disease he has. For example, if the patient is having stroke, we treat with blood thinners. It can be in the form of heparin or the other drugs like dabigatran or apixaban or rivaroxaban. These are all drugs which are used as blood thinners, and then this drug, actually, we across the spectrum of COVID, they use this anticoagulants for a few weeks, so that it is well known fact that a patient with a moderate to severe COVID who has recovered, they have increased propensity for vascular complication. It can be in the form of the cardiovascular complications like coronary artery disease, or in the blockage of the blood vessels in the brain or in the peripheral vessels. So they, as a blanket treatment, they use this anticoagulants so that the complications are mitigated. Then subsequently, along with these medications, some we also use immunomodulators like steroids, and various monoclonal antibodies have come, and there is newer medications are coming, like many antivirals. Along with that, antibody cocktail regimen also has been tried. Initial this one was for this plasma therapy, but nowadays the plasma therapy is not being used widely. The other aspect of this COVID and brain and neurological diseases is whether patient can take vaccine. So most of the time, if you take the risk-benefit ratio, if you take vaccine, the affection of the COVID with regard to a person, along with the brain involvement or the vessel involvement of the brain, is mitigated. So if you take the risk-benefit ratio, if you take vaccine, the complications can be stopped. So if a patient has probably previous history of stroke or previous history of seizures or previous history of any neurological complaints, so don't worry about it and take vaccine. So it can be in the form of Covishield or Covaxin. So either of the vaccine you can take, so that the complications are there, but it's very, very minimal, so that if you take a risk benefit ratio, it is very high. So I suggest that you always maintain social distancing, as you all know. Along with that, whatever lifestyle management, along with that, don't worry about this one, vaccinate as early as possible. So thank you.